A very good afternoon, everyone. On behalf of CII's India at 100 Foundation, I welcome you all to the marquee conversation series, I Have a Dream. The series features distinguished individuals recognized for their excellence who have shared their personal journeys and vision for India's future. It is my pleasure to welcome today a visionary of our times, Dr. Swati Piramal, Vice Chairperson, Piramal Group, to share her journey and her thoughts on India at 100, shaping the future through the lens of public health. It is also my pleasure to introduce Mr. Rajan Navani, Chairman of CII's Council on India at 100, who will anchor the session. Rajan, over to you. Thank you.
Thanks, Aparna. A very warm welcome, Swati, to this conversation. Aparna already called you a visionary leader. And, there's a reason, right? There are very few people, Swati, who have, been able to capture healthcare, education, and public policy. I think if these three things can work together, nothing more can be important for India to transform to become a developed nation. So in that light, you are one expert that we are blessed to have in our midst today. With your background in medicine, business, public policy, as a young person who has championed the women's role in leadership positions in healthcare and so many other credentials to your name, which many are aware of. I mean, you've been part of the advisor to the prime ministers earlier. You have made such a positive difference. And of course, as Piramal Enterprise Director, you span across a range of industries. But I think today's conversation, Swati, is also about your role that you have been able to play as a very large influencer on LinkedIn. And I think where you've even been asked, how do you do things? I think from an India perspective, and through this entire India at 100 journey, we've had wonderful ideas. What will it take to shape, change India? But I think, the key is how do we get things going? How do we foster more women in healthcare leadership roles? You're a role model to so many, and we are, taking this conversation, of course, live today, but it will be archived. It will be viewed over the next 22 years as India turns 2047 as a guide to what India should do. And I really look forward to a conversation today that can, cover multiple aspects, in the time that we have. So with that little introduction, over to you, Swati, and maybe, you can share with us your perception to begin with, maybe through, some other interactive media, as a LinkedIn influencer on how do we get things done.
Thank you, and I'm really full of gratitude for CII for inviting me today's session. So I was reflecting on this idea of how do I do things? Actually, I didn't even know. And then I asked all my students, I asked all my colleagues, asked my teachers, actually tell me how do I do things? And they came up with a few ideas, and I put it together using a Japanese anime graphics, just to explain and perhaps show some parts of my journey. So may I have the presentation, please? Thank you. Full screen. Yeah, so if I want to really think about the world as being a beautiful, a joyful, and healthy place, how can each one of us make that difference? And how do we care? And really, one of the metaphors that I always use is you have to do well and you have to do good. My story started in medical school when I met Mother Teresa. And she came to my little clinic, and she explained that to see the suffering of children and to do something about it was one of the important goals in life. And I took it to heart, and I think I'm so grateful that she walked in through my door. And this is just some pictures of her at my clinic. And I saw this little girl on calipers. She was only 4 years old, and she couldn't walk. And I thought it was not a wonderful sight of a young child who cannot even run. And I wanted to do something to change her life and the others around her. At that time, where my clinic was in Parel, which was endemic for the mill area in Mumbai, and children were affected by polio. And we started the first no polio zone within a 10-kilometer radius of my clinic. And 10 years later, I had to shut down my clinic because it was so successful. That prevention is cheaper and better than cure. And mother actually taught me that. So I do owe it to her to say that she was an important part in my journey. The second big piece, I think, is getting knowledge. All of us must try to gain as much knowledge as we can, to immerse yourself into jnana. So be dedicated in getting that knowledge because that will serve you to the best of your ability. This is just a mnemonic of Harvard, where I went to university. And I had a unique honor that I was the first Asian woman to be the commencement speaker. Before, it was people who really spoke well, were dynamic, and yet they gave this honor to a small Indian woman. So I was full of gratitude that they did. And so the idea is to learn, constantly learn. And one of the things I think women do this better than most people is to build partnerships, partnerships that prosper, become a pioneer, becoming an entrepreneur. And the way you can do this is to always do a network. I think women are very good at networks and to respect all cultures. So just to explain a little bit of their journey in our pharmaceutical industry, we first acquired a Nicholas Laboratories, which was an Australian and English company in 1988. We had previously a long heritage of textiles, but in 1988, we moved into the knowledge-driven pharmaceutical industry. And even at that time, we wanted a healthy initiative for a disease-free nation. And then we acquired the Swiss company, Indian part of the Swiss company called Roche. It was a strategic alliance, and I launched perhaps the first biotechnology drugs in India for critical care and oncology. Then we had a joint venture with an American company called Allergan in 1994, and we celebrated this year 25 years of a joint venture, one of the oldest joint ventures in the country. And this is in eye care and really putting our emphasis on eye health in India. The Boehringer Mannheim was a German company, and so it was our first entry into diagnostic products. Because to have a disease, but to diagnose it early and well was really part of the health journey. Rhône-Poulenc was a French company, and it catapulted the Piramal healthcare into being ranked of 2 in the Indian pharmaceutical industry. And we started off at 48 and we climbed really step by step to become a leader. Over-the-counter drugs was something with our partnership with Reckitt Coleman, a UK company, Aspro, Saridon, Dactocalamine. These were some of our brands. We also focused on Ayurvedic medicines and surgical products as well. So why was this giving us a very good leg up in the pharmaceutical industry? And we thought there was a part missing, and the part missing was research. Relentless hard work, believing in innovation, and looking at science, which sees deeper and understands the universe better. So it was also jnana, which we had, and then the action, karma, using that knowledge for action. And that's when we invested in R&D. And we acquired a 26-year-old Herbst Research Center in 1999. It gave us the idea of discovery research, finding completely new drugs. And we were pioneers or innovators in finding new drugs. We then looked at pathology laboratories because that was a very big part of diagnosis. And histopathology is looking to see whether you have cancer or not. Finally, we did a very nice partnership with the government itself on genomics. At that time, genomics was a new buzzword in science, and the CBT, Center of Biotechnology, spearheaded by Padma Vibhushan, Dr. Mashelkar, was a CSI lab, and so we partnered with the government. So to become an industry leader, one of the secrets, a most important one, is to have a strong value system, being at the core of everything that we do. This was really rolled out and taught to all employees, serving on the shop floor as well as selling any medicines to anyone. So value systems was really one of the secrets of our success. So we planned every detail. We looked at Gyan, Karma, and caring, Bhakti. We call it Bhakti. These are ancient words derived from the Bhagavad Gita. But we built this grand plan centered in values. And we used our values with meticulous detail to plan everything. I think there is a role of leadership and spirituality. This is particularly good in India. We are very, very strong in spirituality, using your values in everything that you do, and the deep knowledge of spirituality and the Vedas helps you live a full and more joyful life. I think women have both the strength and compassion to be a leader, and that is, compassion is a beautiful word. There's actually training called a cognitive-based compassion training, spearheaded by His Holiness the Dalai Lama and taught at universities around the world. How can we be more compassionate? Can we be trained? If we are a doctor or a nurse or somewhere in the healthcare system, do we have automatically compassion, or can we be trained to get there better? And I think women naturally have it. And therefore, when I was the head of one of the Chamber of Commerce, I made sure that in all my committees that there were a vast number of women leading it, whether it was in banking, highways, or finance, or biotechnology. We just had women leading that effort. And I think the results that I was so humbled to receive from our own President of India, the Padma Awards. But one which I treasure a lot is from my own alma mater, Harvard University, being a distinguished alumnus. And really, when the French government honored me with one of their highest civilian awards, it's one thing to get it in your own country, but one thing is always pleasurable to be recognized for your global efforts. I've also worked with prime ministers, with here's Chief Minister Narendra Modi, with Prime Minister Manmohan Singh, and many other leaders around the world. Our own president, President Abdul Kalam, who himself was a scientist, and so on. So it's been just a global, effort of a network of trying to improve public health globally. So I think being inclusive, reaching for the stars, making a difference, you can do this together as a network. And whether it is an industry association, whether it is looking at whether India can reach the best in patents and filing new patents and innovative medicines, or doing something innovative for everything that we do. So I had the honor of meeting President Clinton and President Obama as well. And world leaders, this is an honor that you get when you are the leader of science and technology, because almost every country in the world wants to be better at their R&D, better at their innovation, better at their healthcare. And they really reach out globally to form a network of individuals who really care about public health. One of the things that as a woman I always do is to have humor, have fun. And I feel that you have to be joyful in everything you do, see beauty and joy in everything. One of my hobbies is gardening. I love flowers, blooming flowers, and I try to keep them everywhere that I can. And I did the first Indian garden at the famous Chelsea Flower Show. It was related to cricket. It was called India, A Billion Dreams, because the color of this rare flower you see on the top left was a Himalayan blue poppy, which is the same color as our Indian cricket team. So really, it was one of the fun types of thing that I like to do, something about culture. Health and wellness and nutrition. I think nutrition helps humanitarian goals. Today, when a doctor sees a patient, he almost forgets about telling them about nutrition and how to improve your lifestyle. Unlike, the hospitals, and they don't really have time, they're very busy. But really, this is the one key in Ayurveda. It was known that food is your medicine. And so nutrition really helps to meet those humanitarian goals. One of the secrets I have is using imagination and creativity. When you use creativity to do anything, it is always moving and inspiring to not only those people around you, but to the younger generation. This year, I was invited to be on the jury of the 1925 Padma Awards. And as one of that, we were trying to save whom we call the unsung heroes of Indian art and culture. And I saw this Kathakali, the Pava Kathakali from Kerala, where only one village is left making this beautiful art form. And efforts are therefore on to try and prevent it from going into extinction. So it is moving and inspiring to also respect your own culture. And I think art to communicate is a very nice secret. It transforms things magically because artists create a sublime experience to whatever you want to communicate. And then that really works so well. So just to summarize how I do things before we get into a nice chat with Rajan, I use knowledge, action, care. I believe that doing well is also doing good. You have to be creative. You have to have love and compassion. You have to be joyful. You have to have a lot of strength and always do things in partnership, reflecting on what you do and using the arts and the science and in health will help everybody become a much better, more joyful, and a better life for man, woman, and children. Thank you.
Wow, what a wonderful presentation, Swati, and so crisp, but covers so many dimensions of, I think, not only what you have been fortunate to go through in your life, but something that I think India needs, plenty of in each of those buckets that, especially the last slide that you showed, how do we create a nation, with citizens across all ages, like what you rightly, ended with, man, woman, child, the elderly, living in that, true spirit of compassion. And our Prime Minister always says, Vasudev Kutumbakam, really taking all of this along, not only for India, but from India, for India and then for the world, right? I think, and that's the journey, a longish kind of a marathon that, we as a country need to run, but we have to have 400-meter sprints, hold ourselves accountable for what we can achieve in specific periods of time, and then see how to enhance those outcomes. But given the challenge of India, right? I mean, you're aware, and on the other side, the massive opportunity that exists to be able to bring about this change. I'm sure the creative you is awake every morning, excited about what you can do today. But when you go back to bed and you dream of an India, the ideal India for you, and an India which will happen in 2022. What do you see?
So, I happened to see a young girl walking to pick up water in a matka for her home in a village just recently when I visited a village. And I thought to myself, if one day this young girl, the water would come to her instead of she going to pick up the water, that she could always be in school rather than doing housework, that she could always dream of studying whatever she wanted in life, whether it is science or physics or English or Hindi or whichever language, and that she dreams of going forward. And that I dream of the day that her children will be born healthy, that she would be able to look after not only her family, but also her children, to be really healthy and happy, and to make sure that her family is a center of the new civilization, where India at 100 can achieve so many things because the whole family is healthy, doesn't have disease, is able to use technology very creatively, is able to journey the whole world and learn from everybody to move forward at pace. I dream of that young girl just being the bulwark of a new civilization for the Indian woman, for the Indian family, and being at the center of growth.
No, I think it's a beautiful vision, and I think what we rightly said. It takes a lot to make that transition happen, or it will take, and we have a certain time frame, in within which we need to kind of accelerate this pace. As we think about this journey going forward, what are those key levers, right, that can drive this accelerated change? You mentioned technology somewhere, right, as a part. Today, India, we are while we are technology providers to the world in so many things. Is the Indian engineer that has created those trillion-dollar market cap companies everywhere. How can we actually use technology, particularly when it comes to the areas of health, and especially bringing about that the transformative difference. Japan has this society 5.0 kind of a mission, given what industry 4.0, where they put the citizen at the center and set technology around you, for how does the citizen navigate. But from an India context or an India lens, especially when it comes to health, how do you see the role of technology, particularly, Swati?
So I'm a director of the Piramal Foundation, which actually works in 112 aspirational districts of India, which is the least, the lowest indices in health in these 112. So the Prime Minister requested us to work in these areas, in the area of health, education, and water. And one of the things that we have been doing is the digital transformation. Just give you an example. In Bihar, every district hospital is connected to a command and control center in Patna. And through that command and control center, we know whether there's an epidemic of some disease, whether there is, the encephalitis, which comes every seasonally and affects so many children, whether, there is tuberculosis, which is difficult to treat, or, what are those healthcare indicators are constantly tracked. And once we do this, that is in real time, and it is established in all the command and control centers in around Bihar. And this has helped drop infant and maternal mortality. And the reason is that you know where the medicines are available, you know whether the right equipment is at the right place, you know whether the right personnel are working, you know if there's a disease outbreak and you have to move people towards that disease outbreak. So you know all those things. And if you know that, you use systems thinking to plot all the different levers that you can to improve public health. Now, this has been such a successful experiment that we are now doing it in other states. We are doing it in Uttar Pradesh, and we are thinking about the whole of the Northeast. Must remember that India is not one country. It's not the same everywhere. You put in digital and it works. No, it is impacted by things like weather. For example, in the Northeast, they always have floods. And 6 months of the time, there's no public health center. In the other, there's mountainous snow in Kashmir. And it's very hard to deal with mothers who are expectant mothers who are going to have a baby in the very, very difficult climatic condition. So we have to understand arid plains, snow-driven mountains, riverine geopolitical areas. In fact, indeed, some areas where it's so forested, it's very hard to go to. And so these are places where technology, I think, will be the quantum jumper. To use drones where you can't reach. Sometimes they're terrorist infected forests. And then you want to go there to find a sputum sample. And how do you do that? You use drones to fly there and fly that sample back to a diagnostic center. So to me, the real answer is widespread use of digital transformation technology in public health. I think we have the money to do it. We have the capability. We have the engineers. We have the equipment. We have everything. Why can't we just do it?
And we've done it, right? If you see in financial inclusion, UPI and, Aadhaar, that whole combination has done such a wonderful job. But, I particularly liked your idea of setting up like a command center, in a particular thing, in a particular district, at the lowest, congregation of society or of a village, or where one can technically track not only what is changing externally, but with AI and all, go deeper into individuals, right? And I think over a period of 22 years, as we go to 2047, we can really map an individual and on a real time basis help them monitor their health. So brilliant vision that comes there. But I don't think government alone, will be able to do this, right? Like you said, it's your foundation, and you've been, one of the pioneers in making some of this happen. But if we had to bring more private sector, particularly the CSR and many other elements that the private sector can bring, because it's not just the money, it's also the skills, it's the time sometimes that needs to be volunteered, both pro bono and otherwise, to make these changes happen, along with maybe the government drive and government capital. Do you see this public-private partnership? Because you mentioned the word partnership, and you also mentioned that women are better at structuring partnerships and maintaining that, and I fully agree. You know, is there a role for a deeper private partnership, and can women, therefore, in that light, play a much larger role to build consensus, and bring larger number of stakeholders together to genuinely solve problems on the ground?
Yes, you're absolutely right. I think public-private partnership work, they've been shown to work. They work in very amazing ways. Now, you cannot expect the private sector to fund the whole of India's healthcare sector, for example, where the government spends 20 times the amount of money that we would spend in CSIR. So how can this work? And so the way it would work is to have a pilot project in digital transformation, or an experiment in, let's say, flying drones, or looking at, one parameter and making sure that you use system thinking to cure, let's say, a rare outbreak of encephalitis somewhere. And if you can figure that out, and then you multiply it all over India, and you multiply it perhaps all over the world, that experiment and the success in that experiment, knowing that this works, this technology works, this way of thinking works. And the private sector's role is one more important thing. It's not just to be a pilot, but also to look at behavior change, to make sure that that happens. And we are good at business, we are good at making things happen. So how can we make sure that the huge amount of expenses that the government is incurring is spent quickly, efficiently, at the right place at the right time? And how can we do that very efficiently? So I think it's about efficiency as well as technology.
No, and I think what you rightly mentioned earlier, the systemic change, and also when we deliver this healthcare, right, to ensure that people are using that healthcare, there's a large role, right, in awareness, in education. Sometimes you raise the word nutrition. I still sometimes get scared when I hear the statistic of the level of malnutrition, that exists in India today, which not only impacts, and especially women and pregnant women, and the next generation, that is, born from thereof. And we might deliver, maybe iron or, certain forms of protein. But, how do we educate people, to do more? There must be many examples like that on the ground, that you come across. You want to share some such examples?
Sure, just one of them, which is my pet peeve,
Yeah.
is that 70 years after independence, 70% of Indian women and children still have anemia, which is a completely preventable, curable disease. Now, it is because of poor policy. Sometimes these iron tablets are so useless in quality that even the consumer throws them away. And the iron is simply not reaching the woman and not reaching the child. Growing, anemia, stunting, intergenerational malnutrition, all those not so good things which happen when a woman is not strong enough to bear the child and to have, just have that resilience of good health. So how can we change policy? How can we improve the quality? How can we look at innovation into something which we've been doing for 75 years, but not quite doing it right? And having a new, let's say, a transport system of iron through the intestine. But that needs research. That needs scientists working on the problem. That needs funding from all sorts of sources to find that way or method to take care of this huge public health problem. in a similar way, we have almost every disease that you can take care of. Protein, protein, everybody's now having shakes and things like that. But the commonest and most affordable protein you can get is from the gram, chana gram, the chana. You have roasted chana on the streets of Mumbai, or you have, chana chor garam is called, or you just have it with salt and roast chana. It's very good in protein. It's very good in the B vitamins. It's very good in iron. Why can't we do this? It grows widely all over India. But that behavior change also requires education, requires knowledge, requires people to learn how to grow it. The agri industry also has to work together to take a national look at what we can change in public health.
No, and what you rightly said, this can make such a big difference at the ground level. Even underserved populations where sometimes, maybe everything is not able to reach as effectively. But these are simple things that can be done. So from an India perspective, right, like you rightly said, different cultures, different languages, different economic profile, and we want to deliver, a particular level of healthcare. And of course, it needs to be affordable. Like what you rightly said about iron, because we are saying it's affordable, it cannot compromise on the performance or the quality that people just don't benefit from it. But we talk of price performance, right? The performance keeps increasing, but the price keeps coming down. R&D and innovation around that. How can we really, get the underserved populations, access to some of these things? Is there, I know there's no magic pill, but is there at least a direction or a trajectory that you think, as a country we should follow?
Yes, so, the 112 aspirational districts designated by the Prime Minister have the lowest healthcare indices. It so happens that their location is in the most difficult to reach areas. For example, Baramulla in Kashmir, or in the Northeast, or in Palghar district in Maharashtra, 100 kilometers from Mumbai. And still you see stunting, you see the children really not tall at all, the girls having anemia, all sorts of things. So how can we work in these districts to really improve healthcare? And that is one of the things that we do in a public-private partnership. We use technology, try to use behavior change to improve health, education, and water, three critical things in the aspirational districts. If we can do those 100, India's average will go up. And we'll be able to achieve our Millennium Development Goals. Today, these areas are dragging us down. And whether we have to move the national average up, I think that might change things a lot.
Yeah, and different regions besides the aspirational districts, states, depending on their, economic or even gender and many other profiles, would have different priorities at a different point in time, right? Over the next, say, 22 years. And while health and education, go hand in hand, and we rightly say these are very important benchmarks, at some point it comes down to the policy, right? Like what you rightly said, when I look at healthcare and I see around the world, people are talking of we will pay as a government to keep you healthy, right? Wellness, we are not going to pay to give you a little longer life, right? Or to extend health, support to you when you're in hospitals, because we see the US system that has got largely distorted because the amount of spend that happens, and then you have a Singapore that's quite clearly moving to a wellness kind of a society, right? So when you see wellness and preventive health versus treating, health in a particular way, how do you think policy should be framed? Because that's another background and area of expertise that you've seen. Is it involving people? Is it really doing what is right, bringing how does one really build a policy, and how does it evolve over time?
So I mentioned about 100 million people live in the 112 aspirational districts,
Right.
but another 100 million live in the tribal areas of our country. And the diseases are entirely different.
Yeah.
Because they intermarry, they have sickle cell anemia, they have drug-resistant tuberculosis. It's not something we see in cities. And so therefore, that whole, to get another 100 million, 200 million, right up there in terms of healthcare and public health. If we can change those 200 million people, I think we'll have done a great job by the time we are 100. But you were saying, about policy, how can we change our policy to be more proactive, use more digital technology, and to use behavior change? Those are the things I think that will work very well. Just to say, one big advantage we have here is our firepower, is our strength of our doctors, our nurses, our health, our ASHA workers. Actually, the center of public health is about 1 million women who are ASHA workers who are working all over India. And so they are the, what do you call it, the centerpiece of the change in public health. And if, somebody was saying in a board meeting that I attended yesterday of a French-Italian company, that they have a 2-year waiting list for a cataract operation. Hey, in India, we have a 0 time frame or waiting period where we actually do cataract surgeries at very low cost and in distant villages with, using all our immense firepower of our amazing surgeons and our amazing clinicians who work so beautifully. So I laugh when I see their long waiting periods, when I say that we have, I think, the best doctors in India. It's not a joke because they are the ones who populate all the big hospitals in the US and UK and Japan. So everywhere you see Indian doctors.
And I know 30% of Americans are treated by an Indian doctor. The latest in diaspora report showed that. And is there a way, therefore, to take that, like just take cataract, right? Like an Indian, cataract center, anywhere in the world, you can get it done instantly in $20 and, go back. What I'm trying to say is the regulatory policy across countries, right? Doesn't make that happen as seamlessly as we are talking, because obviously health of citizens also involves data of citizens, and we've seen that becoming quite important as we move forward. Also in the recent times we are seeing tariff barriers being put where countries are becoming inward looking, so crossing borders or percolating of borders through in good initiatives might also become challenging. Do you see that? And in light of that, what again, it's what can India do, of course, for India, as we have discussed these things, but as we move towards 2047 and to a position of global leadership, right? I mean, India will be, a top 3 economy in the world. It will also have a lot more power, on a global stage. What do you see India doing, as we move global? Our companies are doing really well, but how do you see India progress, particularly in this space, as we move forward?
In the medical field and in the scientific field, you will see the top names in that field, at least 1 or 2 are Indians. Even in the science field, the number of patents filed or the number of journals published. So they are there, our center, a whole thing about Jnana is always there for centuries, this respect for knowledge. And I think that will power us through the next century. But how can we be the leaders? Healthcare is a very regulated industry and it's very hard to go across borders. Doctors Without Borders is just one initiative where doctors from many countries operate in underserved countries. And I think India is very good at doing that. It does help out neighboring countries in times of crisis and many other things. But I think the real change will be when the regulations are lowered, when the price of healthcare just becomes unaffordable in the West. They will have to look at making the system better. So I'm not sure the way it's going now, whether it's going to do that. But in future, I think it'll be really, really getting the best people at the best place at the best time, at the right time.
No, and what you're saying, at a time when these will go so high, or you will just not be able to sustain it as a society, right? That's when I think a lot of these things will trigger. But there are other again opportunities, but also challenges with both regulations as well as the aspirations and entrepreneurship and private sector and technology and disruption moving at the same time. Big theme today when you go to Silicon Valley, I was there 2 weeks ago, right, is longevity. There are billions of dollars going into, extending people's lives and also ensuring that the quality of life is that much better. But for a country like India, you talked of 100 million tribals, 100 million aspirational districts. We'll have 200 million elderly people, to along with our youth, great advantage, which will need healthcare, which will need, an increasing amount of care. Also, if you remove the word health, and all of that, how do we as a country prepare for that, Swati? Because these are going to be real challenges. People will live longer, and we've seen that happen, over a period of time. How would a country like India address something like that?
So Mr. Gates was here in Mumbai a few weeks ago, and he said his foundation is looking at two areas. One is nutrition. It's strange that American Foundation is looking at nutrition around the world. We in India, we eat fresh, we eat every day vegetables, and it's not the case in many of the developed countries. So his foundation is looking at better nutrition across the globe, including Africa, including United States, and so on. And the second area is using AI. I think we've talked a lot about AI and everybody's saying everything is AI and machine learning. But how do we use that data to actually get better at healthcare? Today in ChatGPT, you can even put an X-ray and say, what do you think about this? And it will tell you what it's reading and how it compares it to 20, 30,000 X-rays that it's seen before. And so I think AI will really make life easier. I doubt whether it will replace ever the human being, at least in our lifetime, and may in the next, I don't know. But really, how it can really crunch hours of working and working nights to see something and years of training and not miss something. That I think would be its biggest use in healthcare. And of course, in development of new drugs. But today it's $1 billion or maybe 2 billion now for one new drug, and it takes 10 or 12 years. How can we crunch that time? How can we reduce the cost? And if we can do both, then we can actually we can really revolutionize healthcare and public health across the globe.
You talk of AI and you immediately goes to what are the ethics? We talk of, genome and gene therapy. Are we going to create clones? How is society going to move, especially from a regulatory standpoint as technology, creates massive change in an accelerated time frame, right? What you were just mentioning. I think these are all things that India, of course, can take a lead, but will have to collaborate with many other governments, companies, with it. And you started your presentation with individuals, right, playing their role, because the only way to survive a society that is getting more complex, more uncertain, is to strengthen your inner self in some shape and form. I mean, we have a platform where we say mindfulness, in the morning through think right, and then nutrition through eat right, and then, you move right with the right yoga, and then you sleep right. And, that gives you a right life, because India has taken this, to the world. Are we doing enough for that in India? This knowledge which exists, this ability to use technology, is private sector needs to do a lot more, maybe from an investment. Is it more a collaborative exercise with government, with state governments, with districts? Like, what is the best formula? Is there one formula? I mean, it's a very open question, but the idea is that for us to think along, and along with the people who are watching this, right, to become participants in this change, because this is not something that, a few people can do. It really needs a nation to get involved. Do you see that movement happening, and what can it take to make it happen?
Yeah, I mentioned the role of spirituality. I think that's what makes us very different from the rest of the world. India's strength in spirituality, the ocean rock or the bedrock of the way life should be lived, coming from 3,000 plus years, of our ancient epics, telling us the way in which we must live our life. And that spirituality today, the word yoga is heard almost as if it didn't even come from India, that it was invented somewhere else, where every clinic is about yoga. So it's very nice that I think we are devoting ourselves to those. But one word where I think healthcare is different in India as it is compared to the rest of the world, and I think that's compassion. Uh, we train people in cognitive-based compassion training. It's called CBCT. And this was enumerated by His Holiness the Dalai Lama at the Emory University, where he put researchers on the job to understand how compassion would work in delivering healthcare, in the outcomes of healthcare treatment, and how could we do this? And we, to our delight, we found that when we trained people at the district hospitals, let's say in Bihar, about CBCT, and then we looked at the practical application, how doctors, nurses, even the worker who cleans the operation theater, all working as a team to deliver healthcare outcomes, worked like miracles. And so the idea of compassion is so beautiful. And when I talk to all my friends all over the world and I say, this is what I think is different about India, and they say, yes, that's completely missing in our countries, delivery of healthcare. We really need more compassion from the people who deliver healthcare. But often, even a doctor or a nurse who's talking to a patient is just writing the medicines and not even looking at you in the eye and not even thinking what lifestyle modification can you do to help your disease, because they are not reimbursed for that, right? So the idea of compassion, I think, is universal. It is felt in India. I think an Indian doctor will always talk about lifestyle first, then say the medicines, and then they will say, okay, this is what you should do, and spend time listening, talking to the patient and their families. I think this idea of compassion is very different in India from the rest of the world. And I think we can build on it, and then we can do much better.
No, and I think we can reflect it in everything we do, right? Because we're talking of India getting leadership globally. They always say it's a clear thinking head and clean working hands. But the differentiator is that warm, caring heart, which you kindly brought out, which defines leadership from India. It defines service, as a way of life, right? Seva bhav, which we talk of, and so many aspects of India and Indianness that can actually, shape up things very differently. I don't know how our time has run, and we can keep going on, but I want to talk a little bit, and maybe the last couple of questions about, you talked about women, right? And I think you started with that. Half of our country is women. Many of them, of course, are homemakers. You know, we don't have, I think, enough involvement in the workforce. The role that women can play, what you have seen in transforming India, right? I mean, I don't think anyone has really encapsulated that entire gamut of roles, even in nurturing good men. I mean, let's put it to that point, that the role of women in shaping this Viksit Bharat and the new India of 2047. Really would like to see how you envision that part, because I know it's something that's so close to your heart, Swati.
Now, I think you used two beautiful words, seva bhav, the idea of service, the idea of compassionate service. Is not like a waiter in a restaurant where you are paid to put a dish on your table, but it is a word which is much more deeper than that. It is something like a mother does for a child. She doesn't ask for any return. She does it just from her compassionate heart, and she's always doing it for the rest of her life. And I think perhaps women are good at that because they are natural at seva bhav, at delivering that caring, that compassion, that network, that asking for help when it's needed, that way of doing things in a family, being at the center stone. I love the word seva bhav, and I think that's unique about India. That's unique about Indian healthcare. It is a unique about Indian women. It is unique about Indian culture. It is a unique aspect of our lives. And I think that is something that we can build it, define it, grow it, train people using it, and see the outcomes of how, when you use it, what happens. And you will see a remarkable drop in every wrong index that you can think of, whether it's healthcare or it's agriculture or whether it's water, it's everything in which you can see Seva Bhav acting, in our police, in our nursing, in our doctors, in every woman who works and leads a company, in a team. And I think this aspect of Seva Bhav, if we can really enlarge it, and learn how to do it better, I think that would be the secret of a Viksit Bharat.
No, wonderful. It also speaks of the person who is sharing this right now, and with Nari Shakti, and we'll end with this, comes Yuva Shakti. The future cannot of any country, is in the hands of the young people of the country, because they are not only the ones who are going to benefit from it, but they have to play a role to shape it, and I think in that light, Nari Shakti and Yuva Shakti are, two big powers from an India standpoint as we move towards India at 100. There are a lot of young people listening to this, discussion, and will get influenced over, many years to come. What is your message to the young people of India?
Yeah, so we have something called the Piramal Foundation, and they really depend on Yuva Shakti. We have 5,000 young people who we call Gandhi Fellows, the spirit of Gandhiji, the service of Gandhiji. They learn that over 2 years, and they work with us in the most remotest corners of India for 2 years of their life. When they come out of that 2 years, they are the strongest, most powerful men and women you can ever see. I call them my little army because they are the armies of change. They are the armies of Seva Bhav. They are the armies of Viksit Bharat. They are the armies which will take India to 100 at a really high level. And this belief in youth is something Ajay and I really like to talk about. We love to meet these young people. We love to see their achievements. And really, Gandhi Fellows, we call them, are the change makers of the world.
Yeah, no, and I think that's what we need, change makers, and for young people to say fellow change makers and work together, collaborate, because it's only with that spirit of collaboration and the spirit of seva that, India can transform and be transformed in a manner that it can shape the future of the world. So, Swati, it's been such a wonderful conversation with you, ever inspiring, and I'm sure that what we have discussed will go a long way in shaping many thoughts, many ideas, many people, many governments, and hopefully many in the private sector. Something that Ajay and we keep talking about. How do we get, the private sector of India to not only, of course, do more, but also take responsibility along with government, along with other stakeholders for the future of India. And thank you so much for your time, for all this knowledge, as we move towards India at 100. Thank you.
Thank you, Rajan. It was a pleasure
Thank you.
talking to you and everybody at CII. I
Love
worked for many years in that field.
Absolutely, absolutely. And we're not going to end here. We're going to come back to you and work with you, to make all these things and change happen on the ground. Thank you. Thank you so much. Thank you, Swati. Thank you.